So my name is Summer Riddle. I've had lower back pain for probably about the last 17 years, 18 years of my life. I am now 30. I've done a lot of farm work, broke horses, so had a bad back. I was really skeptical about trying the dry needling until I finally got talked into doing it.
So today we'll be doing dry needling on a patient who's having chronic lower back pain. There's also radiculopathy, shooting pain down the sciatic nerve all the way down to the leg. The cool thing about dry needling, it's these needles basically we're actually doing a therapeutic lesion. As the needle passes through the skin, the body immediately mounts a response for defending or healing. As the needle passes the skin, it goes right through the muscle. That's another layer of alarm that sits in the body, and the body was like, well, what just happened is a foreign substance that just entered the skin, now it's passing the muscular part, so the body will mount even a bigger response. Now as you take this needles all the way to the joint, there will be a response even further, and you'll create a localized and a systemic response. So now I tricked the body to come and bring the healing to the areas where the patient is not experiencing any relief. The entire shaft, the response with the entire shaft of the needle, both locally and systemically. It combines the ancient art of needling therapy with acupuncture and the Western medicine of actually needling anatomical points. So right now we're going to needle the lumbar spine with the joints and the nerve root that are actually exiting. Alright. Get your enemy, so this is right in the middle. And go right. You're going to feel the spinous process, and you're going to put it right in between. You tap it really quick, and you put it right in the middle. It's usually not painful. Is that painful?
Not that spot.
And we do another spot. So you do a few points on the actual spine, then you do points right where the nerve root exit, which is literally right by the center. And you angle it toward the joint. Again, think of this as a therapeutic lesion. You trick the body to come into the area, and the body will bring the blood, and the blood will bring the healing. When a patient comes in, this is the needling part where a patient comes in with chronic low back pain that has radicular symptoms, which means shooting pain down the leg all the way to the foot. And Summer, she's actually experiencing chronic low back pain that radiates all the way to the back of the leg, all the way sometimes to the foot, with tingling and numbness. So the art of dry needling, basically, as you take the needle and you put it, these are myofilament needles, very, very thin needles, they're sterile needles. You put them right through, as you put them right through the skin, immediately the body mounts a response. A foreign substance, what's just going on, and it's going to either defend or repair. There's nothing to defend against us, so the body, basically you trick the body to defend and to repair the area. So as you penetrate the skin and go right through the next layer, which is the muscular layer, if the muscle is spasm or the muscle is spastic or if there's a trigger point, you can put the needle right through the belly of the muscle or the trigger point, and you will basically mount a response from the body to vasodilate and reduce the tension, and they're supposed to reduce the spasticity of the muscle. So the muscle will loosen up after you get done with the needling. It usually takes about 10 minutes or so. Once you pass the muscular part and you take it all the way to the joint, like in this area right here, that's the spine, the nerve root are coming right through the joint. So if you take a needle and put it right through the joint, that's the third level of penetration. The body will mount a further immune response, and it will actually create a systemic through the whole body and a localized response. And again, now you get more, basically you're directing the body's army to the areas where you want the body to spend its energy and healing power. And there's old saying says, you can have inflammation without healing, but you can't have healing without inflammation. So the inflammation was the body's, cells, immune response cells. You basically you redirect them to the areas where you want them to focus on. In this case, we're having chronic low back pain, so you needle right in the center between L1 to L5. And yeah, so after we needled the spine, the nerve root, the SI joint, the sacroiliac joints, then we needle the sensory nerves. These are great for pain and inflammation. We call those the cluneal nerves. Another thing about needling is they're therapeutic and diagnostic. Meaning, therapeutic meaning that they get rid of the pain, reduce muscle spasm, modulate inflammation. But they're diagnostic in a way where if you put a needle right through the muscle and then you're trying to get the needle out, and the body's still holding on that needle, that means the immune response hasn't taken its full course yet. The vasodilation hasn't occurred yet. So you can actually leave the needle further until the body will vasodilate and the immune response is complete, and you should be able to remove the needle from the joint or from the muscle very easy. So then okay, this area I need to focus on more because it's taking a little bit longer, or this needle has not responded yet. So then kind of clinically you're able to actually put that in the workup of the patient, and that will help you significantly. And seeing if a patient is not responding versus a patient that is responsive to care. We're going to try and get the needles out. I'm going to demonstrate to you what areas have already been basically done, or areas that we need to focus on a little further. So we'll try this area, that's the nerve root. Okay, that was easy. And this area, this point, is done its course. Let's try another area right in the spine. Look how easy that is. It's perfect. Let's try like an SI joint. See this pole? So yeah, see that? It's not ready. We gotta let that move further. Let's try to see the sciatic nerve point. Okay, that was easy. So that's basically what I said about diagnostic and therapeutic. So you could tell what areas are ready versus areas that you need to focus on. Good. That was good.
So I did it, and for me it was basically instant relief. I used to have a hard time bending and getting up and down, and I get it done about every week now, and I think it's amazing. I extremely recommend it to anybody. So.